I'm Mikaela. I'm the clinic director at Highbar in Pawtucket.
So I'm Reid, and I'm the clinic director who's going to be taking over in our Franklin clinic and was the clinic director in our Attleboro clinic. What does growth mean to me? Having opportunity. I think the biggest thing is feeling like you have the opportunity to accelerate in your career. Whether that's what your goal for growth is. That goal could be moving into leadership. That goal could be moving into different roles, and it looks different across the board. But yeah, growth is just having the opportunity to advance my career.
Growth means to me just improving on yourself, and growth is important to be passionate about what you do. For me, when I started out, growth just meant expanding my clinical knowledge, whether that's manual therapy techniques or evidence-based practice. But now, over time, growth really, it's still important to maintain clinical skills, but growth means to me like how to be a better leader, and how can I communicate better? How can I instill passion in my team? How can I lead with empathy and just create an environment where people feel valued and want to work? So yeah, over time it's changed, and now growth to me means how can I be better for the people who count on me. Yeah, I think a lot of people supported me, obviously, like my family, my friends supported me, my colleagues supported me, but I think the most important person that supported me to this day is my manager, Cara. I think she's always encouraging to me. She challenges me and she pushes me to pursue opportunities, and I think that she's really been someone that I can count on and learn from. And so shout out to Cara. Thank you for always having confidence in me, and I'm better for it. I appreciate that.
Yeah, I was really lucky. I got in an awesome clinic right off the bat with a really supportive clinic director who, Loren supported me through, every goal along the way, whether it was teaching, whether it was taking students. And then as she was departing, said, this is the next opportunity. You may not feel like you're ready for it, but I think you are. And that encouragement, they make you feel really good about your, abilities to excel in a position. And so Loren kind of led me into that next step. And from there, I've been really lucky to also work with Cara, Cara has kind of pushed me along the way and encouraged when we're opening a new clinic, hey, you have this experience, let's utilize it to start something fresh and new in a whole new area, which is intimidating, but somehow made it seem like it wasn't going to be difficult because I had the support the whole way. She was going to lead me and guide me through this opportunity and change.
I don't think you're ready. I think you just need to have confidence and put your best foot forward and pursue opportunities when they're in front of you. So my advice is to not be ready and just go for it.
There's knowing you're ready to make a leap into some sort of leadership. By the time you're ready, it's usually too late. You have to be ready to take those opportunities when they come, like you said, Mikaela. It's so important to just feel a little uncomfortable. Feel confident though, know you have the support, and that even if you're gonna meet struggles and maybe you're not fully ready to take it on, that there'll be someone there to pick you up if you have some trouble going along the way.
I think the balance between being a clinician and being a clinical leader is a tough balance at first, and I think it takes a little bit of practice and a little bit of structure. For me, I want to be present in my best self in both roles. So, when I'm with my patients, I try to focus on being with my patients, being the best physical therapist that I can be. And then when I'm done with my patients, I'm trying to be engaged with my team and being able to be present in the responsibilities that I have outside of that. So I think it's still a work in progress, but it's important to have structure and prioritize along the way.
I think Mikaela touched upon a really important part. You almost have to have two different selves. One where you're really present with your patients and that you put all of your efforts and all of your focus in on them when you're doing that treatment time, but then at the same time being always readily available for your team for anything and everything they possibly need. So it is kind of living a duality of two different people at work, and it takes a while, like you said, to figure out that balance. Can take months, and I'm still learning. Honestly, a year and a half into this, still figuring out some of that balance, and it never feels perfect. And you feel like you'd be pulled in a couple different directions at different points, but just making sure to give my all and give separate pieces of myself to my coworkers and to my patients. Yeah, so some stories that stand out from why I love being a clinic director, I think is seeing that transition to now taking some of my past students and now bringing them on and being a part of our team and growing our team in Attleboro to what we want to be, right? And establish ourselves as a really great, PT care team in our community, and getting to, not just treat patients, but also bring on people who are phenomenal at doing so as well, and have a same common goal of, giving back and doing really well for our community.
Yeah, I think the key moments that have really made being a clinic director awesome is just being able to work with a wide variety of clinicians that are passionate in a lot of things. And I think that, being able to work with a bunch of people that have different passions and we can impact a lot of people that come into the doors. I think that's one of the most cool things to see, especially in a clinic of my size with multiple different specialties. And I think the second thing that really stands out is that I'm able to grow leaders, and I think that's really cool. I mean, I see, the transition that I've made in myself for growth, and then I'm hopefully able to help people in my clinic reach their goals. I have multiple people that have come from my clinic who have now been clinic directors or accepting new positions in clinic directors, and I just think that's a really cool thing for me to see, is the growth in my team and me being able to be there to support and help them reach those goals.
I've been really fortunate in my short time in Attleboro. I brought on a couple of clinicians. It just shows some of the change I've been through over the years. Two of my past students actually came in looking for roles with Highbar. And being the one to get to take them through that interview process, take them through what it's going to be like transitioning from being a student to being a clinician, being a full-fledged physical therapist, was just an amazing opportunity and cool to feel that difference and change.
The best part of being a clinic director is really just listening to the goals of your team and helping them achieve their goals. And I think it's really cool to work with a bunch of people who are professionals, who come to work every day and are passionate, and just being able to provide them the confidence and the opportunity that they need to be successful and to follow their dreams.
Common issues that clinicians typically come to me as a clinic director, a lot of it is trying to figure out what their next step is, because there's a lot of different avenues, and just talking out what their passions are and figuring out, what is growth for you. And that's often really hard for some clinicians. They just went through getting a doctorate. They've been in school for years. They've been doing all sorts of learning education. They don't know if they're supposed to, and they all think they're supposed to have a next goal of something clinical or this or that. But sometimes it's providing the avenue. It doesn't have to be that. And just giving them an idea of what maybe a different track for them can be, and giving them those opportunities when they arise, I think is probably the biggest thing I tend to see clinicians come to me for.
Yeah, I think people come to me as a leader for, same thing, mentoring and making sure that, they're on the right track with their career, like what they want to do with, now that they have their doctorate and they want to pursue physical therapy, like what types of specialties do they want to go into, or like you said, do they want to go into leadership? What are the pathways? What are the opportunities for that? Maybe they don't have any desire to go into leadership, but they want to do, more teaching and other things like that. So there's different types of avenues that people come to me for, so I can try to help guide them there too. And just being able to, pursue their specialty if they're really interested in neuro, and I'm able to help guide their caseload to help them see the population that they want to see, or they're really interested in pediatrics, and how can I structure their schedule that they are going to be in the clinic at the times where the patients that are pediatric are going to be in the clinic. So just kind of helping, doing what I can to support them in any way possible. The personal impact for me as a leader is just, I take tremendous pride in being able to, lead the biggest clinic in Highbar, and I think that it comes with a lot of challenge and but also excitement, and I think it's really truly made an impact on me both professionally and personally, just being able to navigate challenges and to, kind of help people achieve their goals, and I think that's really been eye-opening to me to see the impact that I can make on culture, and I can make on people's dreams, and I can make on the company itself. So I think it's really been eye-opening to me to see that being a leader, you truly do have an impact on people's lives and people's careers, and in the best way possible.
I think my biggest advice for someone who's thinking about moving into a leadership role is find a mentor. Find somebody who's done it, who's been through it. And luckily, here at Highbar, we've got a lot of awesome people you can lean on. For you, it was Kara. For me, it was Loren. I think they drive you into and push you to one, accept positions earlier, to try taking on more responsibilities. Long before being a clinic director, Loren started giving me some pieces of the clinic director position, saying like, you're gonna run our skills, you're gonna own this. And having somebody who's willing to, one, help you grow, and it obviously helps them to an extent to give them a little bit more support, but to give you that opportunity, find yourself a mentor. Find yourself someone who's gonna push you into that role and give you the support you need.
What type of person should really be interested in a leadership role? I think that the type of person who is always looking for new challenges, looking for, to be a mentor, looking for coaching, looking for, someone who is passionate about, one, physical therapy, but two, about helping others.